So we are joined today by Health and Social Care Minister Karin Smyth for the government. A very good morning to you. Thanks very much indeed for joining us. So the UK Supreme Court ruled yesterday that the legal definition of a woman under the Equality Act refers exclusively to biological sex. Do you welcome that ruling?
Yes, I mean, I think it's good that we have clarity for women and women who have brought this case and for service providers providing services.
Well, yes, and we'll talk about some of the practical implications in a moment. But before that, does Keir Starmer owe Rosie Duffield an apology? Formerly a Labour MP, of course, now an independent. She'd campaigned for women's rights to be upheld in the way that the Supreme Court has agreed with and wasn't supported by the Prime Minister.
Well, I think Rosie Duffield stood as a Labour candidate, actually, in the election, as did I and hundreds of others. And under Keir Starmer's leadership, with Keir Starmer's support, we received an overwhelming majority at that election. She subsequently has chosen to leave the Labour Party. She wasn't, happy with the Labour Party, and she is an independent, and we wish her good luck in her being an independent MP. But Keir Starmer changed the Labour Party on a number of issues and made us fit for purpose to face the electorate, which we were roundly defeated on in 2019. If people remember, I certainly remember it really well. Strong manifesto in 2024, including on this issue this morning and including the issue that I'm here to talk about, which is reducing those waiting lists. And that's what the Labour Party was elected on, and that's what we're focused on.
She was ostracised by the party. And
well, that is her view. That is her view, and she's entitled to that view.
What the Prime Minister said to her.
But the Prime Minister, as the Leader of the Opposition, gave support to her and other members of Parliament and members of the Parliamentary Labour Party who have the same views on this issue over time. We were elected on a strong manifesto to support women, to support safe spaces in the manifesto, and crucially, to change this country for the better on that plan for change.
But also, she said, can I just say, sorry, just to interrupt, apology for interrupting, but she said only women have a cervix. Asked if he agreed, Keir Starmer said in 2021, well, it's something that shouldn't be said, it's not right. And
before the election, he said that wasn't the right thing to say. He cleared that up in terms of getting those definitions, and that's why our manifesto was very clear. He changed the Labour Party through our policies. It's hard work. Many of us have spent a long time in the Labour Party making sure that we are fit for purpose, that we face the electorate on the issues that matter to the electorate. This is one. Clarity for rights for people is one. We are very proud as a party of our we brought forward the Equality Act in 2010 under the last Labour government. We brought forward the Gender Recognition Act in 2004 to give people rights and dignity. We believe in those policies. It's very welcome that the Supreme Court has clarified that, because I heard your previous piece. Under the Conservatives, this was allowed to run and run and run. It was the Conservatives that started looking at self-identification, for example, under Theresa May. It was a Conservative leader of the party in the House of Commons who stood at the dispatch box and said trans women are women. Really unhelpful for the Conservatives. So I think they also need to look at themselves, as do other political parties. We were very clear in our manifesto on our offer to the British public. The British public, half of whom are women, overwhelmingly endorsed that manifesto on things like I'm talking about today, getting down those waiting lists, getting people treated closer to home.
I'm going to come on to the waiting list, I promise you of that. But let me just, there's such a big judgment, I want to get your sense of the repercussions. I wonder what you think it means for transgender people. The court was clear that transgender people will still have protections from discriminations, but there are groups representing them that are very concerned. Amnesty International described the ruling as disappointing, with potentially concerning consequences for trans people. Should they be concerned? Do you understand why they feel they've lost protections?
Well, I understand in the sort of hubbub of media and social media and some of the terrible things that are said in some of those platforms, that people who identify as trans are part of that protected under the gender reassignment part of the Equality Act will feel concerned, of course. But this judgment was about women, about women's rights as defined by sex, and clarity to service providers. And the court is very clear about that. It's a long judgment. It's important now that all bodies review it carefully, that don't jump to statements that may alarm people, that that we take time to look at that. We will be looking, obviously public bodies have been asked to look at their own guidance, and we will do that very, very carefully. We're very proud of our protections under the Equality Act that we offer to people. We do think rights are important and privacy and dignity is important. That's why we supported and brought forward the Equality Act, and that is a record of which I've been a member of the Labour Party, an active member of the Labour Party for 40 years. I'm very proud, and we will continue to defend that and to support people.
And I want to ask you about the Gender Recognition Act. That allows people to obtain a gender recognition certificate. Yesterday's judgment, though, says that those certificates don't make trans women women in the eyes of the law or share women's legal protections. So what does a gender recognition certificate now give somebody?
Well, the Gender Recognition Act allowed people who identified differently to the sex they were born in the dignity and privacy of preventing differently. That's what the Gender Recognition Act did. So that still is in place. But as I said, if there are implications, then that needs to be looked at very carefully in the guidance.
Let me just ask you about the kind of culture war that has built up around this. It's become quite a toxic debate, hasn't it? Do you think that this judgment will draw a line under it, or could it fan the flames further, do you think?
No, I really hope that it does draw a line under it by clarifying what sex means, by clarifying that people have different protected rights under the Equality Act, and being very clear to all organisations what that means. And
what about the NHS? You're a health minister. What does it mean for the NHS?
Well, having privacy, dignity of treatment is obviously really important to people when they seek treatment. If people are in a vulnerable position if they're seeking treatment, they need help and support. And privacy and dignity is a key part of everyone's clinical care. It has been the policy of the NHS for many years to have same-sex wards to provide that dignity and privacy. If people are in hospital, which of course is the minority of people end up in hospital. There are generally individual rooms for people, smaller wards. But already before this ruling, the NHS was looking at how to support people who identify differently to the sex that they are born in. That's both transgender men and transgender women.
You've already mentioned, and we can come on to it now, this issue of expanding a scheme to get more patients' care in the community and where GPs get rewarded for referrals to local alternatives instead of putting them on hospital waiting lists. Does that scheme not put an extra burden on GPs?
Well, there is an extra administrative burden, which is why there is a £20 payment for that extra work that is involved in doing that. But it really is an important part of our promise to the British public to get down those waiting lists, not by just putting more and more money in, but actually reforming the way the system works. And this policy called advice and guidance does exist already, but it's not used widely enough, so people across the country don't have that access. So rather than going on a waiting list and sometimes being on there for over a year, getting more stressed, getting more ill, it allows the GP to have that specialist advice from a doctor in hospital much more quickly and maybe have an alternative to going on that waiting list. Often people go on a waiting list, as you'll know, and as people watching will know, and get told, actually, the GP can manage this locally, or I'm going to send you to something else. So it brings that much more quickly. It's much better for patients. We hope to reduce that, people going onto the waiting list, so that over in time it will make that waiting list come down. And it also means that people who are on the waiting list get that specialist care in hospital that they need, because 90% of patient contacts is with a general practitioner. Few people go into hospital as a proportion of that waiting list. We want to make sure that the people who really need a specialist get to see that specialist, but other people who can be treated more locally, more conveniently, more quickly, that can happen.
Is there sometimes a risk, though, that it's not assessed properly? If they're sent to a local service, some of the more serious cases might get missed, the people that should have gone straight to a specialist.
No, our GPs, we have an excellent standard of general practice in this country. They are generalists, and they will now have that quicker access to a specialist to make sure that that person, if they can be seen differently, if they can be seen quicker, or if there's a way of monitoring them, or if there is medication that can be prescribed to help them with that condition, that happens more quickly. But both of those are excellently trained, high-quality clinicians in that advice and guidance relationship between primary and secondary care, so people should feel really assured about that.
And finally, 705 migrants crossed the Channel on Tuesday. That's the highest number of arrivals in a single day so far this year. The Labour Party accused the Tories of losing control of our borders. Is that what you've done?
No, they did, and that's why we have had to, again, one of our key focuses on Keir Starmer's leadership of our plan for change is to resolve this issue. That means smashing the gangs, it means working across the Channel to make sure that we do that. That's what Yvette Cooper has been leading. It is going to take time. Those gangs were allowed to be established under the previous administration. They stopped the processing of people so that that system got blocked up. That is what we're trying to do. We have a Borders and Security Bill going through Parliament currently. I hope all parties support us in that work.
OK, well, Karin Smyth, we appreciate your time this morning. Thanks very much indeed for joining us. Thank you.